Kirthi came to the hospital with a complaint of ankle pain. After only a short observation, the doctor insisted Kirthi to do some tests without any further explanations.
Doctor, I don't want to do this anymore. I want to go home.
No, it's for your own good.
Ouch! Doctor, the needle is so painful.
Why can't I find anything wrong with the patient?
Maybe it's just a simple pain. Are you sure you're not doing this so you can win some points for the competition?
After more tests, there was no diagnosis for Kirthi.
I'm sorry, Miss Kitty. It was just regular pain. There is nothing
What
wrong
do you
with
mean? What are all the
I'm
tests
sorry.
for then?
I'm sorry. I'm really sorry.
First issue is talking politely to the patient. We can see that impoliteness will be able to incite anger in patients that would cause a lawsuit towards the hospital. Secondly, it is observed that doctors who give attention to biomedical aspects but looks down on the patient's own feelings and values, it is interpreted as impoliteness by the patient. Last but not least, a doctor-patient interaction does not longer focuses on the technical or biomedical aspects, but is expected to balance between the responsibility to improve the patient's health and respect the patient's feelings.
Besides, doctors should tell the purpose of tests and give sufficient information to the patients before any procedure is carried out. They should also have an open communication with their patients. During conveying information verbally, the doctors and also medical staff should communicate straight to points, avoiding excessive, unnecessary information. They should also foster an atmosphere in which questions are welcome. Next, doctors should put information in layman words instead of jargon words to make sure that the patient understands. And by highlighting and circling important parts of information in handouts to patient is also very helpful tools.
Patient autonomy. Firstly, informed consent. Patient must be informed about why the treatment is suggested, what the possible benefits, risks and side effects, including what could happen if refused.
Now, let's move on to the next topic, medical professionals. Based on the story, first, the doctor should take responsibility for her action. Instead of running away after apologizing, she should confront the patient directly and try to ease the situation by finding any possible solution. Next, it is obvious that the doctor did not apply non-maleficence in treating the patient. If painful procedure needs to be done, doctors should reconsider and think of alternatives so that least or no harm exposed to the patient. Lastly, we can see that the doctor was prioritizing her self-interest over patient's need. As a professional, doctors should prioritize their patient in any kind of situation and give them the best care in every aspect.
Patient's right. Firstly, right to safety. Patients have the right to get safe and high quality treatment so that they will feel comfortable during the treatment.
Interprofessionalism in medicine. From the story, we can know that giving opinions and advising each other, for example between a doctor and a nurse, is considered as an interprofessionalism. The first, offering help and advice, then treat and converse with respect, next, be courageous to speak up.